Let's review what information we're going to need to complete this employee health entry screening requirements for Hilo Medical Center. I'm going to go over a few pages, and it's going to require you to slowly take notes and pay attention. We'll see that just below this employee health screening requirements, it's going to say that we need to provide the supplemental information that's being placed onto this questionnaire. And it has to be filled out by a licensed healthcare professional, and you can't just put this in there. It has to be verified by a healthcare professional. Here you see preferably a physician. Okay, so tuberculosis screening. They're going to want a two-step. This two-step can be done with the Department of Health. It's basically you go in, say on a Monday, and then on a Wednesday they read it. In the following week they'll give you another shot on a Monday, and then on a Wednesday they'll read the results. Once you have the two-step, you're good. That two-step is good for 12 months or 1 year. Again, you need to get a two-step TB test, and it's going to be read at 2 different times, requiring you to have that results then inputted here, verified, and we need that data or supplemental information to put into this folder or file when we submit it to Hilo Hospital. Again, the two-step is good for 12 months or 1 year. If it's outside of that, we'll still need the two-step to verify that you've completed that before, and then you'll need an annual TB test. So again, you would have to go and get your TB test. You'd been given it 2 days out, and then they would get read, and the results would be verified and initialed here. Usually the results are taken back to your physician, and the physician verifies that result, and so your doc will sign there. If there is an issue where your result has read some kind of greater than the minimum requirement to say that it's a negative result, so your skin tests positive, well, they're going to ask us to go ahead and make sure that we have had some kind of documentation. So it's going to need you to provide that result of when it was that it was marked positive. And then we're going to need some type of chest x-ray with the results verified by your physician that there's no disease state. So as we move to the positive skin test, we would need to have that record that showed that you took the skin test and the result was not negative, it was positive. And within the 12 months of entering into Hilo Hospital or going on to their clinicals, we would need to have an x-ray done, and these findings would have to be reviewed by your physician or a medical professional to say that there's no disease state, and then they would verify initial in the verification boxes. All right, so now we're moving on to more immunizations. This is for the measles, mumps, and rubella, the MMR, and varicella. We would have to take these 2 different vaccination steps here. It's a one-shot kind of immunization. And so you get a 1 shot here, and they list it down. And then you would have had a second revaccination some point in your lifetime. These results would have been labeled and put down on a immunization record. And what we need is those records that show that you've had the first step and then the second series, and your medical professional will verify that you've had these series. Varicella is its own, and so you would have had a first immunization at some point, and then a second set that was done at a later date. Again, you would need those shot records, those immunization records, so that your medical professional can verify that you've taken those. If we are missing any of these, we'll have to go through and take these series again. Ultimately, if you've had the protection and you've developed the immunity, it would show in what's called this titers. This titer would have to be requested by your medical professional so that you can have your blood drawn so that they can test to see if you have the immunity. When they do this immunity, they do more than just the MMR and varicella. And I'm going to jump ahead right now, and they'll probably do hepatitis B. When they do the blood test, all right, so we're moving away from the vaccination series and the verification by your physician. We're moving over to the blood test in which they test whether you've built the immunity. When they do this, they take a blood test, they'll read it. That result from the lab will be sent either to your physician or you'll have to take it to your physician, and then your physician will verify whether it's reactive or positive that you have the immunity, or non-reactive or unequivocal, which means that we're not sure if you do or you probably don't, which means you would have to get a booster. Again, these results from the blood test are reviewed by your physician or your healthcare provider, and they'll initial here. And now here's where it's sticky, is that if you don't have a reactive or positive result and you have a non-reactive or unequivocal, you'll probably need to have a booster series. All right, moving on. So tetanus, diphtheria, and pertussis vaccination. And then the tetanus. This here, you should have had a TD, tetanus, shot some point in time in your past. And so you would have had to have 2 of these series done and then verified as you take that shot record, immunization record to the physician and have it verified. If we're missing any of these, we're going to have you to take those. Again, the Tdap here, we're looking to make sure that you take that. And if you haven't, then you're going to have to get this series itself. Now, some places, they mix this up. All right. Tetanus, you should have one current every 10 years. And then this Tdap, you should have this done once. And if we don't have this immunization record to be verified by your medical professional, healthcare provider, your doctor, if this is blank, we're going to need you to get the vaccination. Hepatitis B. Most most students or most applicants here would have had a first set of series being done. I believe it's in the early 90s that we started to do this already. So all applicants born around that time should have had their first set as they were born. And usually after that first series, I think it's the first month and then month after, and then within the next 6 months, so a total within 6 months, you're having these 3 series. They would then test to see if you built up the immunity. This would be a blood test. And again, they usually do this with measles, mumps, and rubella, the MMR, and varicella, and then the hepatitis B to find out if you have the immunity. And here again, we want to have a positive result, or they're going to request us to think about getting a second series done. In some cases, what equivocal means is that it doesn't show too much of a positive or a negative, and some of us may have an immunity, but because our body has not been sensitized to hepatitis B at the current time, our immune status remains at a very low. It means that you have the immunity, it's just not enough to be identified as a positive. So he may request you to have a booster, and then we'll go ahead and check a titer later. Again, the titers that we're doing for this immunization screening is used to determine whether you have built up an immunity. Anytime the immunity shows that it's a negative reaction or non-reactive, it means that we do not convert, we did not develop the immunity. And it's going to be strongly advised that we have the inoculation or immunization done again. This is to make sure that when and if we are exposed to a patient that may have these types of pathogens, that we will not have a reaction, that we will have a robust immune system to combat that. And that's why it's very important that is verified by a healthcare provider or your medical physician, because this is something very serious. And we do not want to have an exposure that converts into disease state. All right, thank you for your time. We'll go ahead and open it up for questions.